This is Chapter 4, Relationship Quality, Instilling Confidence. One of the most important skills that you need to have is the ability to instill confidence in a patient that you can perform a competent examination. This is really going to come into play when you start doing your rotations in the third year in the hospital and clinic settings. When patients see someone who's very young in a short white coat, frequently the feeling is that they're being short-shrifted unless you can make an impact on them. So what you need to really try to convey is this idea here. Trust me, I'm a medical student, and that's not being ironic. That's actually meant to be an authentic goal for you, is to be able to competently examine a patient and relay that information to your resident or the attending that you're working with. It's okay at any level, whether you've been in practice for 6 months or 30 years, is to say, I'm not sure, but let me find out for you. We work on a team here. I'll be right back. I'll try to find out that information. So you're not expected to know everything, but you do need to convey that help is on the way if you can't provide it. What you want to avoid is this here, which is to say, don't just say, I don't know, and then I'm not sure, I'm a medical student, I don't know what to do. You want to avoid that kind of statement to a patient. It may be what you're thinking, but it's important to suppress that for the good of the patient, for the good of the relationship. It doesn't help to convey your anxiety to a patient who may be in a state of anxiety for their own reasons. The other issue is just overtly looking like you're anxious. And if your handshake is sweaty because you're nervous, or you're breaking out in a sweat, or you're biting your fingernails or doing something that makes you look anxious, you may not get very high ratings in this regard, even though your responses to that kind of situation is automatic. So it will be discussed with you, and if this comes up, and you might have to take some steps to try to deal with your anxiety, but the best solution to that is a lot of practice. The more practice you have with patients, the better you're going to get. The other issue is being overconfident, and sometimes this is as big a problem as being underconfident and conveying that. What you want to do as a third-year student is to really, again, completely be honest with your rank, not present yourself as a physician, and but also confidently explaining what it is you can do, what you intend to provide for the patient without embellishment. This is the ethical thing to do.